So let's talk about working as a primary care team to improve access for your patients. So why is this important? It's really essential for the patients to have trust in your practice so they can get in when they need to see you. The advanced access model provides a methodology for you can reassure your patients that they can be seen on a routine basis or on an urgent care basis promptly when they really are needed. Or if they can't be seen that same day, someone on the team will reach out to them and provide them the access that they need. In systems where there are poor access issues, there's a loss of trust in the care system and the care team. Primary care practices become regulated to just routine, non urgent issues in the minds of your patients, and they end up going to the urgent care or the ED for things that really didn't needed to be taken care of in those settings. And those clinicians don't really have the context of the patient in mind as they see the patient in the urgent care or ED outside of their normal medical home. This leads to excessive testing, repeated studies, and often a lot of patient anxiety. The cycle begins to repeat itself if it's not corrected. So, access is truly important for your patients in order to get good primary care from your clinical team. So, when we talk about access, what is it that we want to do for our patients when they're seeking care? First of all, we need to be able to triage them based on the need that they have to see us either the same day or in a more urgent visit in the next several days, or schedule it for routine appointments depending on what they need and what they're requesting. So, how do we work on this as a team? Well, first of all, let's talk about the primary care team. So, our current model in the primary care team is evolving in the last several years. We do have primary care clinicians, both physicians, nurse practitioners, and PAs. We also have a team nurse or triage nurse in most clinics. We rely on medical assistants for a lot of the rooming and preparation work within the clinic functions for normal visits. Many clinics have now established care navigators as part of their team model as well. The care navigators play an important role in reaching out to patients and in some ways function as care coordinators or community health workers within your clinic system. We also have scheduling staff at the reception desk who do a lot of work in getting patients appropriately scheduled so that they're seeing their provider or someone on the care team with the right timing and also for the right reasons. As we look at expanding the primary care teams, it's critical that we have integrated behavioral health on our teams as much as possible. The integration of behavioral health has become a key component of both providing well-rounded care to our patients, but also to triage them appropriately so that they're seeing the right provider for their care needs. Similarly, we want to have integrated care management nursing staff on our teams as well. The care managers play an important role with our high-risk patients in managing their risk factors and engaging them in their care and working closely with clinicians in order to deliver the care plan that the clinician and the care navigators have worked out together. We also value highly our social worker components that we have in our teams because they provide many resources to patients and oftentimes provide a level of counseling to help them navigate their personal and psychological problems that they are facing, often influenced heavily by their social determinants of health. There's other value-added team members that you can add on your service if you have the capacity to do it or if your system is large enough. And those would include pharmacists to provide pharmacy support for medication refills, surveillance, education, and also medication therapy management visits, which Medicare supports. If you have the capacity of nutrition support at your clinic, that's also an excellent add-on. It should be valued highly because of how they can manage your patients with obesity and diabetes. Another component that some systems are developing now at a more robust level are physical trainers and physical therapists. These skill sets are critical in helping patients recover from musculoskeletal problems and with especially older patients with disabilities to regain better function and control of their ADLs that they need to manage. So the key principles of advanced access are that you want to have about 25 to 30% of your schedule available for same-day access. If you build this model, what will happen is your patients will be able to get in when they need to, and there'll be less pressure on your schedule downstream for patients who are trying to book an appointment just to make sure they have a slot to see you at some point in the future. Having more same-day access and allowing patients who have less than urgent needs to fill those slots over the day allows you to have good access for patients and often will surprise them when they can get in right away for something that seems rather mundane on a day where there's not other more pressing needs. The triage nurse plays an important role in filling these slots and learning how the population navigates the call system and getting the people in who need to get in that day is really an important piece of that triage nurse role. We also can use telehealth visits for these visits as well. And so if the patient cannot get in quickly, it's possible to manage them through a telehealth visit or a video visit, and that allows them to get their care needs met without having to drive all the way into clinic, and saves you time waiting for a patient to arrive who may not be able to get in as quickly as possible. One of the models that we're promoting is an idea of a 12-2-2-2 model, where you have 12 routine visits set throughout your day. You also have 2 high value visits, which are 40 minutes long, to allow you to have more complex patient visits and care coordination visit work done with those patients that are high risk. And then having 2 same day visits that are routine face to face same day visits, and then 2 telehealth or same day visits to allow you to give you the option, patients the option to be seen either remotely or on site, depending on their needs. So overall, there are 4 same day visits available on a 18 visit schedule. We found this to be a manageable way to start setting goals for same day visits being readily accessible to many patients, but also to have slots available for high value visits and routine appointments. Next, we'll talk about the advanced primary care planning process in order to make sure that the entire team is engaged in caring for the patient and that the plan is accessible to all of its members.